Chair of the Presidential Task Force and Secretary of the Federal Government of Nigeria, Honorable Ministers, distinguished Senator Sadiq Umar, ladies and gentlemen of the press. Again, thank you very much for coming for our regular press briefing. Over the past few weeks, we have talked about a lot of the added measures, what we call the non-pharmaceutical interventions like wearing masks, social distancing, that we hope to need to do for some time, but we all look to a period where we can go back to speaking to people without wearing masks. But we've also spoken about some things that we hope will stay, like hand washing frequently. And for the health sector, one of the biggest areas that we hope will change forever is our attitude towards infection prevention and control and the appropriate use of personal protective equipment. A few years ago, when we just started work at NCDC, precisely 3 years ago, there was a big outbreak of Lassa fever in the Federal Medical Center, Abakaliki, which is now the Alex Ekweme University Teaching Hospital. We lost many healthcare workers in that incident. I remember going down to Abakaliki, patients were refusing to bury the dead. It was that bad. We collectively worked with the healthcare workers in that hospital. The next year, after a series of trainings that lasted over a full year, constant engagement with the management, the leadership of the state. You know, FETA is one of the most transformed federal teaching hospitals in the country. After Erua, together with Owo, they have become the leaders of our response to infectious diseases. We probably haven't heard a lot about them because they manage a disease called Lassa fever that affects mostly the poor in our society. And the place of PPEs has suddenly become elevated because of the level of society that feels at risk for this new infectious disease. But the rational use of PPEs is really something that needs to become a sustained change in our sector. In most procurement plans of our federal institutions, state institutions, even in private sector hospitals, you would rarely find a procurement of PPEs in any of them. This has to change. During this outbreak, yes, the federal government, state governments, the private sector, our donor agencies, the UN, everybody is procuring PPEs. We're distributing PPEs across the country. We have a whole big logistics plan over the next 4 months of PPE procurement and distribution. But we all know that this is not sustainable. We all know it is not sustainable. We have to go back and normalize the procurement of PPEs into the routine procurement plans of our institutions so that we plan for this and we use them routinely. But this will not happen if Nigerians don't demand that it happens. And we've said this over and over again, but maybe now it will stick, that a patient going to a hospital and seeing a doctor has a right to demand that that doctor is wearing gloves when they're manipulating them. It's not a nice to have. It's something that needs to happen. If you see your nurse going from one patient to the other without washing hands in between, you should ask as a patient, aren't you supposed to wash your hands if you've just touched a patient before you come to me? So there are lots of changes that is now happening in the health sector because of a new threat of this new virus. That are things that we have to normalize in our clinical practice. That normalization has to happen in the medical establishment, but it also has to happen among the populace. The increased emphasis on IPC starts with the high index of suspicion. You see, when you've actually diagnosed the patient with COVID, it's very unlikely that that patient will transmit to you, because you know. Most of the transmissions to healthcare workers and hospital infections have happened before the diagnosis is made. Before the diagnosis is made. Because normally, once you know it's a COVID patient, people start dressing from top to bottom in Tyvek suits. The riskiest period is that patient that comes in and you don't know. And that is where the appropriate use of PPEs is essential in managing risk. Over the last few years, we've worked with the Infection Control Association of Nigeria, ICAN, and the Robert Koch Institute to build a new department, a new unit in the department on IPC. This team is really at the heart of the people that have been going around the country training. When you hear 11,000 people have been trained, it's because of a little seed that was planted 3 years ago, when we started focusing on infection prevention and control, basically driven by the risk of Lassa fever in Nigeria. So, given that we didn't learn sufficiently from Lassa, now is a time for us to learn collectively from COVID. To date, we have trained close to 12,000 healthcare workers, and this is an ongoing process. The training is happening in our health facilities, our military services, everyone that is related to managing of patients. We've developed guidelines. The most important one is a new one called the rational use of PPEs, because what we have seen happen is from the non-use, in some institutions, we have now gone to an extreme use. So, in contexts where we've never used PPEs, suddenly every single person in a hospital wants to wear a complete Tyvek suit with gloves, with gowns, with face masks. This in itself is not appropriate. So, we have produced guidelines to advise what the pharmacist needs to wear, what the lab technician needs to wear. And not just the lab technician by definition, but what role are you playing at that time in the lab that needs the use of personal protective equipment? So this will take time to get used to. And as we get used to this new way of practicing medicine, practicing nursing, practicing laboratory science, practicing pharmacy, we'll get used to these protocols, adapt them in our hospitals, and use them on a day-to-day basis. The inefficient use of PPEs is just as risky as the non-use of PPEs. So over the next few months, we hope that this is one change that will stay with us as we move into the future. Thank you very much.